Assalamu alaikum. Good morning, everyone. My name is Zainab Tariq, and I'm the founder of OSIG and the Khyber Global Health Initiative. Today, I'm going to discuss how our team is using art to transform cancer awareness in Pakistan, beginning right here in Peshawar. So, although I regret that I'm not present in person, I'm really grateful for the opportunity to be able to join you guys virtually through this pre-recorded video. Now, the reason we pivoted to education pamphlets was twofold. First, I often saw stacks of health education pamphlets lying in doctors' offices, all in English in Pakistan. So one day when I saw this scene at Khyber Teaching Hospital, which is a public hospital serving patients whose first language is not English, it felt really strange and even unjust. And that is when I asked myself, why not create the same resources in Urdu in words people actually use and understand? And secondly, I saw a student society from Khyber Medical College, BrainBridge, create seizure first aid pamphlets in Urdu and Pashto and take them into OPDs. So you can actually see a photo of the pamphlet that they used. And the response was phenomenal. So families who once believed seizures were caused by jinn began to understand epilepsy as a medical condition, treatable, manageable. Parents started bringing their kids to clinics. They started coming to Dr. Irfan, a lot of them. We gave them his OPD office address and they started coming there. And the experience showed me how powerful, simple, culturally accessible material could be in transforming beliefs and behaviors. Now, how we did this, the process was actually a lot less convoluted and confusing than the photo in the background. Like most of Pakistan's problems, the solution was pretty simple. We designed these pamphlets using simple tools. So we use free open source health education material online. We used Canva for design, AI for initial translation, and then careful review with doctors and students. This is the first booklet that I made for surgery care for breast cancer. Then this is what I got my team to make. This is the first pamphlet that my team designed for breast cancer awareness and breast examination. And then this is one for oral cancer that they recently curated over the summer. Now, our philosophy when doing all of this was really simple. It is student-led, low cost, and replicable so that it's accessible for everyone. And now going forward, our vision for this is to take these pamphlets out of our screens and into the public. So OPDs, waiting rooms, BRT stations, anywhere people gather, because it doesn't stop there. We also want to measure this impact. How is understanding improving using these pamphlets? Do women actually perform self-exams more often now? Do myths decrease? Because, we also want to pair healthcare with evidence. And speaking of art, why art matters for Pakistan is because it's something that all of us are connected by. Pakistan has always used art for health. Truck art was used to spread polio messages. You can see a photo that I used here on the presentation. We've used TV and theater to teach about HIV and AIDS. So our work stands in that tradition. It's not about pamphlets. It's about reimagining health communication so that it belongs to the people we're serving. Thank you. Now my teammate Hadika is going to do like a little presentation, like a little talk with you guys about our work, and I hope you guys have a good conversation. Thank you very much. Allah Hafiz.